Hi, it's Dr. Queen from Advanced ENT and Allergy. One of the most common things that we see in the office are ear infections, and both in children and in adults. It's not limited to kids, like a lot of people sometimes think. We do see plenty of adults with ear infections as well. And like most ear, nose, and throat infections, including tonsils and sinuses, the usual standard treatment protocol is to use antibiotics to treat the infections. Different nasal steroid sprays, antihistamines, decongestants if necessary, to be able to open up the ears, let the air come in. Same thing with the sinuses. Essentially, the middle ear is basically a sinus. It functions the same way. Gets clogged up with allergies and colds, for example. And like ear, nose, and throat infections, if you've tried several rounds of medications and they've failed, then you might have to have a surgical option. The most common ear surgery that we do is what's called myringotomy tubes. We're basically little tubes that go in the eardrum, letting the air come in from the outside. Now, why is that? Because in order to hear normally, you need to have an air-containing middle ear space. So inside of your middle ear, behind your eardrum, you have to have the same pressure as the outside world, atmospheric pressure. How does air get in there? Normally, it comes through something called the eustachian tube. This is a little tube that comes from the back of your nose up into your middle ear space. And when you yawn and chew gum and swallow, that tube opens and air comes up and it equalizes the pressure to the outside world. If that tube gets blocked, you'll create a vacuum inside the middle ear space, or a negative pressure. That negative pressure sometimes then leads to fluid accumulation. And then that fluid can get infected, and that's how ear infections happen. Even sometimes when there's no infection, the fluid alone inside the middle ear may cause hearing loss. The negative pressure may cause pain. So ear pain, hearing loss, and recurrent infections are the most frequent things that we see. What the myringotomy tube does is it lets the air come from the outside into the middle ear space and essentially bypasses the eustachian tube. They are designed to be temporary. They will fall out, and normally the hole will close over on its own. Rare occasions, the tube has to be taken out if it's been in too long, and on very rare occasions, the hole has to be patched. But most of the time, they fall out on their own, hole closes. And usually, if you've grown out of the problem or you've treated the reason why you had the eustachian tube dysfunction in the first place, you don't need another set of tubes. Frequently in very small children, babies, toddlers, it may be several years before they've grown enough for the eustachian tube to function normally, and they might possibly need another set of tubes. How can you cut down on that? Well, once again, do something that's going to make that eustachian tube open. One thing is the adenoids. Now, we had talked about adenoids in another video, but the adenoids are tonsils that sit in the back of the nose. Where? Right in front of that eustachian tube. And they very frequently will block the eustachian tube. And removing the adenoids has several advantages. Number one, helps you breathe better through your nose. Number two, gets rid of the source of the infection. A yellowish green mucus, for example, turns it more clear that you might find with just allergy or cold alone. And number three, it opens up that eustachian tube and decreases the chance of needing another set of tubes. A couple of things about having tubes in place. It's a very easy surgery. It's done outpatient. You go home the same day. Very quick recovery, usually in the same day. Very simple. On adults, frequently we can even put tubes in the office just by numbing the eardrum itself. Children usually won't tolerate that, but most adults will. The problem though with tubes is they're in there for a while. So now you got to deal with tubes. There's a couple of things with that. You do have to keep the water out of your ear as best you can. If you're going to go swimming, you need to wear earplugs so the water doesn't get down through the tube. It can cause some drainage. But the good news, if that does happen, it's very easy to treat. Ear drops would typically solve the problem. And when the tubes fall out, again, hopefully we've done stuff. Treating the allergy also helps to get the eustachian tube to function so that you don't need them again in the future.